we are getting the first thing, that is anemia. What is called anemia? That is there is some cutoff value on hemoglobin percentage, okay, and if the hemoglobin percentage is not met in a man or woman, we are declaring that person is suffering from anemia. So, what are the causes of anemia? That is grossly divided into two types, that is nutritional and non-nutritional. Nutritional is, okay, we are not getting nutritious substance enough. What are the causes of non-nutritional? Yes sir, Souradeep? Blood loss, কিভাবে? হ্যাঁ, hemorrhage, আচ্ছা, okay, that is accidents or something. Other? Okay, worm infestations. Anything else? Colorectal CA কতজনের হয়? Anything else? Not nutritional cause. Thalassemia. What are these called? Just only thalassemia, or there are other congenital disease that causes anemia too? Hemoglobinopathy. Good answer. And one person you said fluorine. How fluorine is affecting blood production, or how it is causing anemia? What is fluorosis? Excessive or deficient? Excessive fluorine. That causes anemia. Okay. So, hemoglobinopathy and fluorosis. Any vector-borne diseases that may cause anemia in chronic, if it's getting chronic? Malaria. Okay. These are the three main causes. So, of non-nutritious anemia. Okay. That is hemoglobinopathy, vector-borne diseases and fluorine. That is fluorosis. So, these are the first snapshot of anemia, where we in 58% of children, that is from 6 to 59 months of age, they are suffering from anemia. This is a study and getting from NFHS-4 and 5 data. What is NFHS full form, sir? আমাদের ডেমোগ্রাফিতে তো পড়িয়েছে এটা, থিওরি ছিল। What is NFHS full form? স্যার এদিকে, NFHS full form? National S for জোরে জোরে, survey sir. Okay, and 53% of women, that is WRA, and 29% of adolescent boys. Almost half of the pregnant women are suffering from nutritional anemia, and 58% of lactating mothers. Okay, these are the prevalence as per NFHS-4. More than 50%, that is for 11 state and 2 UTs. Our West Bengal is among them. Okay. What are the causes of high burden of anemia? First, there are low iron stores. That is, in our body there is a storage of iron, and these stores are getting depleted with your growing age. Okay. And also the poor iron stores from infancy, childhood deficiency and adolescent anemia. That this is also there. They are also dietary, inappropriate IYCF practices. What is IYCF full form? Infant and young child feeding. Okay. And excessive consumption of iron inhibitors, that is tea, coffee, calcium rich food. What are the calcium rich foods? বলতে কি হচ্ছে, calcium is also we need. So we should know what are the calcium rich foods. Huh? Key meal. Milk. You are saying milk, cow milk. Okay, that is one iron rich food. Sorry, calcium rich food. So, excessive consumption of milk. Do you know what is milk alkali syndrome? Have you read? Okay, please read in medicine. Okay. And also low bioavailability of dietary iron. Can you name one at least vegetable which is rich in iron? Spinach. In our West Bengal there was one thing, that is kulekhada, I think the name. That is too much rich in iron stores. Okay. And we have iron loss due to parasitic load, malaria, intestinal worms, that is which worm? Hookworm, correct, helminths. And poor environmental sanitation, unsafe drinking water and inadequate personal hygiene. And there is one separate thing, that is maternal anemia. Increased iron requirement due to tissue, blood formation and energy requirement during pregnancy. Iron loss from postpartum hemorrhage and also in teenage pregnancy. Repeated pregnancy less than 2 years apart. Okay, that causes the demand of iron and the body iron stores getting depleted. So, it causes anemia. What are the cut-off value for adult male saying that he has anemia? No. What adult male? Less than 11.9. 11.9. And for non-pregnant adult female 10.9. Always goes by 0.9, eta mone rekho. And for pregnant adult female, in pregnancy there is a low level of hemoglobin, so the cutoff is also lower. Please read, see in your park textbook what it is saying. Okay. So, what are the public health implication of anemia? First, it is reduced physical development, impact on pregnancy outcome. What outcome? There were 20% of maternal deaths attributed to maternal anemia. Okay. And also there are reduced cognitive development, that those person who suffered from anemia in their infancy and childhood, by adulthood they are deficient of 5 to 10 points in IQ level from a same normal person. Okay. So, there is deficiency in IQ level 2 for persons those who are suffering from anemia. It is a very long term effect and it affects our country. And also there are economic impacts. What is the Delhi lost? At 1.8% of GDP due to anemia related complications and also anemia treatment. So, we are talking about and focusing on prevention of anemia. We have multiple programs launched throughout years. Now, we are going through Anemia Mukt Bharat campaign previously, which was known as INEP. Okay. National Iron Plus Initiatives. World Health Assembly has proposed a target of 50% reduction in anemia among women by 2025. It was a previous assembly, they targeted that, they actually decided that we should reduce 50% anemia by 2025, but it is still not met because this is all over the country and onek kichhui hoye geche er moddhe. Next World Health Assembly is still due. When it will happen, they will set up a new target. And for their monitoring, that which country has reached their target, they have one indicator. It has been asked, okay, AA, RR. annual average rate of reduction of anemia prevalence? It has been asked, that is why I put it here. Okay, what is that? The full form has been asked. And what our India have decided in NHP 2017, they have committed to reduce anemia prevalence by 3% per year, that each year it should reduce 3%. But what we are current, that is close to 1%, okay, not being 3. And there are NFHS-6 survey is going on, that data will be published, and there we will see what is the actually current scenario now, okay. So, what are the milestone in 1970? 60 mg iron supplementation for PW and 20 mg for 1 to 5 years. PW is pregnant woman. Then 1991, 60 mg iron changed to 100. Then 2007, we added 5 to 10 years age group. In 2013, we launched WIFS, WIPS, that is weekly iron and folic acid supplementation. Then the new thing, that is life cycle approach, it has been taken in 2013. Okay, this life cycle approach has been asked in your Viva, and it might come as MCQ also. The new approach what was taken, this approach thing, cafeteria approach, life cycle approach, you do not have to understand what is this thing, but you have to remember, because these are potential MCQ questions, okay. And INEP program, that intensification of NEP, that is National Iron Plus Initiatives, is changed to Anemia Mukt Bharat, where pregnant woman is getting 60 mg and IFS and WRA, and also 6 into 6 into 6 strategy. It has come in first paper, I think, in last MBBS, last final, third part 1 MBBS exam. So, it is probably not important, but it is still important as your Viva topic. 6 into 6 into 6 strategy. For that, what are the 6 beneficiary, what are the 6 intervention? You have to remember by your heart, okay. MCQ importance to ami chhedei dilam. 6 beneficiary and 6 intervention tomaderke mone rakhtei hobe, and 6 institutional modifications you do not have to remember, okay. That is I am saying, because it will never be asked, whether in your MCQ or in your final exam. If you can remember, you will get some extra marks probably in theory, but it is not MCQ important. What are important? 6 beneficiaries and 6 interventions. Please remember those by heart, okay. So, 6 beneficiaries, 6 intervention and 6 institutional mechanisms or modifications to manage Anemia Mukt Bharat. What are the 6 beneficiaries? You already know. First, women of reproductive age. Here we defined as them 20 to 24 years, but in practical mind, we are going for 45 years also, okay. That is the real reproductive age we are getting. Then children 6 to 59 months. Again children 5 to 9 years. Adolescent boys and girls 10 to 19 years. Pregnant women and also lactating mothers. These values are 17 million or 124 million. That was expected value of these age groups under demographic data, okay. You do not have to remember this thing because these are changeable, but you have to remember women of reproductive age, children, that is 6 to 59 months, again children 5 to 9 years, adolescent boys and girls 10 to 19, pregnant women and lactating mothers. Acha 0 to 6 keno nei? Why it is not involved? Exclusive breastfeeding এর সঙ্গে আয়রন হ্যাঁ দেওয়া যায় কি? আমরা চাইলে কি দিতে পারি আয়রন? এক্সক্লুসিভ ব্রেস্টফিডিং যারা করছে সেই বাচ্চাদেরকে কি আমরা আয়রন দিতে পারি? ইয়েস, your breastfeeding breast milk is containing iron. If the child is deficient on iron and if it is due to some hemoglobinopathies such as thalassemia or hereditary spherocytosis, these all manifest later in the childhood, okay, not in the first 6 months, okay. That is why they are excluded. These are the targets, we are not getting by that. Now 6 interventions, that is first prophylactic iron and folic acid supplementation. Second, periodic deworming of children, adolescent and pregnant women. Third, intensified year-round behavior change communication campaign with the campaign slogan solid body smart mind and delayed cord clamping. In your gynae you actually understand delayed cord clamping er advantage gulo ki thik ache. In community medicine, in safe birth practice, you also get the point, delayed cord safe and delayed cord clamping or cutting. But what are the advantage? For that you have to go to your gynae and obs books, okay. And also testing of anemia using digital methods and point of care treatment. Amra jeta kori, what is the method's name of estimating hemoglobin? Eta tomra pathote korecho? Soheli noy, Sally. Ki dicche? What is that? Is that digital? কি করতে হতো? অ্যানালগ। হাউ আমরা কি করতাম স্যালিস টিউবে? হ্যাঁ, সব মিশিয়ে টিসিয়ে তারপর কম্পেয়ার করতাম, দ্যাট ইজ কম্পারেটর মেথডস। বাট নাও উই আর গোয়িং বাই ডিজিটাল। একদম জাস্ট আমরা যেভাবে হচ্ছে গিয়ে ব্লাড গ্লুকোজ মাপার হচ্ছে গিয়ে ইয়ে পাওয়া যায়, অ্যাকিউচেক, ওয়াসিম আকরাম কিসের ইয়ে করতো, হ্যাঁ অ্যাকিউচেক, সেম লাইক দ্যাট, ওকে। And what are the fifth? Mandatory provision of iron and folic acid fortified foods in public health program and addressing non-nutritional cause in endemic pockets, that is fluorosis affected areas, vector-borne disease affected areas and hemoglobinopathies. Hemoglobinopathies is also endemic in some part of Madhya Pradesh, Jharkhand. In tribal population the hemoglobinopathies is much more actually, that is why these are coming also as endemic disease pocket, okay. So these thing you know, for 6 to 59 months of age children are getting bi-weekly 1 ml of iron and folic acid syrup. Each ml is containing 20 mg elemental iron and 100 mcg of folic acid, okay. Bottle is 50 ml. It has an auto dispenser and information leaflet. What is auto dispenser? Auto dispenser তো আমাদের রোটা ভাইরাসের আমি যখন ভায়ালগুলো দেখিয়েছিলাম সেটা একটা ডিসপেন্সার লাগানো ছিল। ছবিগুলো যদি ফোনে আছে অন্য ছবির সঙ্গে, প্লিজ রোটা ভাইরাসের ছবি, রোটা ভ্যাকসিনের যে ছবিটা হচ্ছে কি আছে সেটা দেখবে, ওটাই অটো ডিসপেন্সার লাগানো ছিল। Then coming to the 5 to 10 years of children, weekly 1 iron and folic acid tablet, each tablet containing 45 mg, okay. It is sugar coated and pink in color. Remember the color and the dose. সবগুলো পারফেক্টলি কারেক্টলি না লিখলে নাম্বার দেওয়া হবে না, ঠিক আছে। ভাইবাতে তো ঠিক বলতেই হবে আশা করি, okay. Then adolescent girls and boys, that is 10 to 19 years of age, weekly 1 iron, that is blue in color, 60 mg, 500 mcg. Women of reproductive, non-pregnant, non-lactating, 20 to 49. Here weekly 1 tablet, it is red in color, 60 and 500. And pregnant women and lactating mothers, that is each tablet 60 mg, 500 for 180 days daily. It is sugar coated and red color. There is one practical thing is there, that adolescent or women of reproductive age or pregnant women, the dose is same. Why the different colors? Why? কেন আমরা হচ্ছে গিয়ে ওমেন অফ রিপ্রোডাক্টিভ এজ তাদেরকে দিচ্ছি রেড কালারের আর অ্যাডোলেসেন্টদের দিচ্ছি ব্লু কালারের? কেন? ডোজ যখন সেম, আমি কালার চেঞ্জ করে আমার লাভটা কোথায়? হ্যাঁ, কি আইডেন্টিফাই করবে? হ্যাঁ, সেটা খুব আইডিয়া আছে। সোশ্যালি অ্যাকসেপ্টেবল কেন, একটু ব্যাখ্যা করো। বাচ্চা কোথায়? এ তো হ্যাঁ, কাছাকাছি গেছে কিন্তু ব্যাপারটা উল্টো। যদি আমি রিপ্রোডাক্টিভ ইয়েকে, সেটা হচ্ছে গিয়ে সবাই জানে ইন প্র্যাকটিক্যালিটি দ্যাট আয়রন ট্যাবলেটস বাকিরা নেয় না, বাট প্রেগনেন্ট ওমেনদেরকে দেওয়া হয়। এইটুকু আমরা করি যে প্রেগনেন্ট ওমেন হলে তাদেরকে আয়রন ফলিক অ্যাসিডের ট্যাবলেট দেওয়া হয়। তাদেরকেও লাল রঙের ট্যাবলেট দেওয়া হচ্ছে। সেই একই লাল রঙের ট্যাবলেট কোনো অ্যাডোলেসেন্ট মেয়ের ঘরে হচ্ছে, মেয়েকেও হচ্ছে স্কুলে দেওয়া হচ্ছে। ঠিক আছে, দে ডু নট নো what is iron, why iron is giving, what they will think. These tablets are making them pregnant, that's why they are giving. Okay, and it creates some chaos. Okay, that's why the blue tablet is for adolescent. Even in some areas that WRA but not married, they also got blue pills. Okay, and now some practical things. Iron tablets কখন আমরা খাবো? When to take? Before meal, after meal? কি হলো, ফার্মা তো পড়েছো? When to take iron pills, before meal or post meal? Post meal. Why? In reality, iron tablet has to be taken in empty stomach. Okay, but in empty stomach it might cause nausea and vomiting. Why I am talking about empty stomach? Because of better absorption. Okay, that's why it has to be taken 2 hours post meal. Okay, জাস্ট লাইক তোমরা যেমন PPBS জানো, পোস্ট প্যারান্ডিয়াল ব্লাড সুগার, ঠিক সেই ওটা যেমন খাবার 2 ঘন্টা পরে করতে হয়, তেমনি আয়রন ট্যাবলেটও নিতে হবে খাবার 2 ঘন্টা পরে। অ্যান্ড হোয়াট ইজ নট টু বি টেকেন উইথ দ্যাট? টি কফি হচ্ছে গিয়ে দেবো না। আর কি খাবো যদি সম্ভব হয়? ভিটামিন সি তো মুখে বলা যায়, আরে প্র্যাকটিক্যালি বলো ভিটামিন সি কি দিয়ে খাবে? হ্যাঁ, আরে বলো না তো ভাই, কি লেবুর জল, অরেঞ্জ জুস, নেটে খুঁজলে এক্ষুনি দেখতে পাবে অরেঞ্জ জুস লেখা আছে। গুগল তো আর জানে না যে তুমি কোথায় আছো, ভারতবর্ষে, এখানে গ্রীষ্মকাল, কমলা লেবু সারা বছর পাওয়া যায় না, তাহলে লেবুর জল দিয়ে খেয়ে দিতে হবে। And what are the most complaints that may come from patients or the beneficiaries? Stool is getting darker. So what you have to do then? Assurance. Anything else? আর কারো কিছু আছে? What to do? So these are the syrup which is available in your department, so it might come as your exam. And these are the red tablets and these are the blue IFA tablets. Okay, both are available, so it might come in your next semester and final. Please study for that. Okay, and these are the formulas, that estimation of IFA tablets, how much tablet is needed in a center. Okay, these are the formulas for 3 age groups. প্রেগনেন্টের জন্য আলাদা ফর্মুলা ইউজ করা হয় এবং সেটা ইম্পর্টেন্টও নয়, বাট দিস 3 formulas please try to remember. Okay, it will be given, the PPT will be given, please try to remember, it is a potential MCQ question. Okay, যেমন ভ্যাকসিন হচ্ছে গিয়ে কতগুলো লাগবে, that is a potential MCQ question, same goes for this. Okay, What are the second intervention? That was deworming. What are the target groups? That is children and adolescent, newlywed and married women of 20 to 24 years and pregnant women. আমরা children আর adolescent দের কি দিচ্ছি বছরে দুবার, that is date is fixed 10th of February and 10th of August. Biannual supplementation of albendazole. What is the dose? 400. What is the dose for children? Half. And for more than 50 for school going children and adult, 1 tablet. Okay. Newlywed, they are also, who are not pregnant, they also provided biannual deworming during NDD, that is National Deworming Day. And for pregnant women, what is for them? When to give a pregnant woman albendazole? First trimester, second trimester, third trimester কখন দেব? Second trimester, okay. It has been asked in multiple times in MCQs, okay. Second trimester or third trimester, never to give in first trimester. So if a patient comes with Helminth's problem in her first trimester, যে আমার স্টুলের সঙ্গে হচ্ছে কি আমি বুঝতে পারছি যে ওয়ার্ম আছে, I have worm infestation in my body and it is causing already anemia, so তখন আমরা কি দেব? albendazole দিতে পারবো না. In some literature it is suggested to treat the patient with mebendazole, okay, but it is not established, but that is a practice because the toxic profile of mebendazole is much less, but government supply is albendazole only. Mebendazole is not supplied. And what is the dose? That is 500. Third intervention, intensified 360 degree IC and BCC. What is 360 degree? Why? 360 degree means in 3D aspect, 360 degree means all over. That is, we have to give IC or BCC. That IC material is information, education and counseling. BCC is behavior change, communications and counseling. Okay, that is the process you have to apply for all aspect of the society in all age group except 0 to 5. Okay, we have to compliance them for iron folic acid supplements. Why we have to take them? Appropriate IYCF practice. For IYCF, what is the complementary feeding and when to do weaning? Which foods are appropriate for children? These we have to inform them correctly, and also increase the intake of iron rich and protein rich food. You know all these things. And practice of delayed cord clamping in all health facility. Okay. What is the intervention 4? That is test and treat using of digital hemoglobinometers in all age groups or in all tests. Mostly in RBSK it is provided for adolescent and by MOHFW or RMNCH unit even for pregnant women. Okay. And iron fortified food. Iron fortified food এর ক্ষেত্রে আমরা হচ্ছে গিয়ে একটা ইয়ে হচ্ছে টাটার হচ্ছে ডবল ফর্টিফাইড সল্ট, আরো এমনি অনেক কিছু আছে. সল্ট ইজ দ্য মেইন থিং that is iron fortified now. We also have in commercially available iron fortified flour, iron fortified rice. These things are available but commercially. Okay, in government aspect we only getting double fortified salts and we are giving this through midday meal service or ICDS service. Okay, যেখানে হচ্ছে ফ্রিতে খাবার দেওয়া হয় সেখানে সব জায়গাতে we have to give them the iron fortified food where food is supplemented by government endeavors. Okay, these are the things only, simple. And what are the sixth intervention? That is intensify awareness, screening and treatment of non-nutritional cases. For hemoglobinopathy there is national program for hemoglobinopathies. Okay, there is a national program. You do not have to read, just remember in your head that there is a national program and there they only advocate of early screening and if it is screened then counseling of hemoglobinopathies, mainly thalassemia, hereditary spherocytosis, G6PD deficiency diseases, all these things. Fluorosis, we have to identify first fluoride affected areas and what is the technique of defluoridication of water? What is the name of the technique? Nutrition e to jache. Nalgonda technique. Okay. And also there is some capacity building with one slogan, Acha pani, takatwar pani, whatever banay slogan er matha mundu thake na. ঠিক আছে, what we are doing, defluoridation plant which are acting on Nalgonda techniques, we are establishing those and giving the water for free. Okay, there are no charges for that. Also for malaria, that is one major reason of non-nutritional anemias. What we are doing in NVBDCP, what are the strategies that has been taken for prevention of malaria? কি মাথা নাড়লে হবে এটা বলো। NVBDCP, হ্যাঁ, that is National Vector-borne Disease Control Program. কি কি স্ট্র্যাটেজি নেওয়া হয়? হ্যাঁ ছিল তো, বলো বলো স্যার। ও পারবে হয়তো, তুই বল। তুই তো খুব ইয়ে হয়ে যায়, পরীক্ষা একদম হয়নি ঠিকঠাক, খাতা দেখেছি, বলো। ঠিক আছে, NVBDCP, what are the strategies? That is, first is prevention of, think like step by step. First we have to do by first লার্ভা গুলোই যাতে না হয় তার জন্য আমরা কি কি করতে পারি? টার্ভিভোরাস ফিশ দিতে পারি, সহজ কথায় জলে তেল ছড়িয়ে দিতে পারি, যেখানে স্টোর হচ্ছে সেই জায়গাগুলোকে নষ্ট করতে পারি। যদি লার্ভার থেকে মশাটা হয়ে উড়ে বেরোলো তখন কি করব? নিজেদের হাত ইউজ করেও মারতে পারি, নইলে মশা ইউজ করতে পারি, অল আউট কিনতে পারি। আর একটা, দ্যাট ইজ ইনডোর রেসিডুয়াল স্প্রে, we can use that. Okay, and what আর যদি ম্যালেরিয়া তারপর হয়ে যায় তখন কি করতে পারি? ট্রিটমেন্ট করতে পারি। ট্রিটমেন্টের জন্য আর্লি ডায়াগনোসিস, কখনো কোনো ভালো কাজ করতে, আর্লি ডায়াগনোসিস করতে পারি, ট্রিটমেন্ট করতে পারি, আর কমপ্লিকেশন আটকাতে পারি। আর ওই সময় যদি নিউট্রিশন অ্যানিমিয়ার স্টেজে যাচ্ছে তাহলে কি করব? আয়রন ফলিক অ্যাসিড দিয়ে লিভারে প্রেসার বাড়িয়ে লাভ নেই, আয়রন রিচ ফুড খাওয়াবো। ঠিক আছে, and what are the anemia management protocol for adolescent? Please study this because this has been asked. Okay, পার্কে হচ্ছে গিয়ে সুন্দর করে টেবিল দেওয়া আছে, তোমরা ওটার থেকেও দেখতে পারো, নাহলে এখান থেকেও দেখতে পারো যে মাইল্ড বা মডারেট হলে কি করব, সিভিয়ার হলে কি করব। What we are focusing, that is 6 institutional mechanism, intra-ministerial coordination. জাস্ট এখনই দেখলে ম্যালেরিয়া হচ্ছে NVBDCP, সেপারেট প্রোগ্রাম, সেপারেট লোক, সেপারেট বিল্ডিং। অ্যানিমিয়ার জন্য we are needing adolescent, that is RBSK, we are for pregnant, we are needing RMNCH unit, that is coming under MOHFW, that is Ministry of Health and Family Welfare. তাদের নিজেদের মধ্যে সম্পর্কটা রাখতে হবে যে ওষুধটা পৌঁছাতে হবে কখন যেন সবাই খায় এবং ওয়েস্টেজ যেন না হয়। এগেন সেকেন্ড হচ্ছে ন্যাশনাল অ্যানিমিয়া মুক্ত ভারত ইউনিট। যখন দেখছে যে এত কিছুর মধ্যে তালেগোল রাখা হচ্ছে না, তখন সেপারেট একটা ইউনিটই খুলে দিই যারা শুধুমাত্র অ্যানিমিয়া কম্পোনেন্টটা দেখবে। থার্ড, ন্যাশনাল সেন্টার অফ এক্সেলেন্স, অ্যানিমিয়া আটকানোর আর কোনো ভালো উপায় আছে কিনা এবং ইজি উপায় আছে কিনা সেটা নিয়ে রিসার্চ চালিয়ে যাওয়া। ফোর্থ, কনভার্জেন্স উইথ আদার মিনিস্ট্রিজ, যদি 2 আর 3 যদি অ্যাভেলেবেল না হয়, আমি এক নম্বর মেকানিজমটার জন্য ফোর্থ মেকানিজমে আসবো। ওকে, কি হলো ওখানে? ফোর্থ আসবো, দ্যাট ইজ কনভার্জেন্স, গেটিং ওয়ান রিপ্রেজেন্টেটিভ ফ্রম ইচ ডিপার্টমেন্ট ইন্টু ওয়ান বিল্ডিং। ফিফথ ইজ স্ট্রেংথেনিং সাপ্লাই চেইন অ্যান্ড লজিস্টিক্স, and sixth is Anemia Mukt Bharat dashboard. We have to make a web portal where the information is available, যে কতজনকে দেওয়া হলো, এবং এরকম একটা ড্যাশবোর্ড যদি হচ্ছে গিয়ে কোথাও থাকে তোমাদের যে কোনো ইয়েতে, যেমন ফেসবুকের উপরে প্রথমেই থাকে একটা ড্যাশবোর্ড, কতগুলো নতুন খবর এসছে, স্টোরিজ কতগুলো, ফ্রেন্ড রিকোয়েস্ট কতগুলো, মেসেজ কতগুলো, তোমাকে আলাদা আলাদা করে খুলে দেখতে হচ্ছে না। দ্যাট ইজ ড্যাশবোর্ড অনলি, সিম্পল থিং। এরকম একটা ড্যাশবোর্ড যদি অ্যানিমিয়া মুক্ত ভারতে থাকে, আমরা ওয়ান টাচ করে পেয়ে যাব কতজন পেয়েছে, কোথায় বাকি আছে, কোথায় স্টক ওভারলোড হয়ে গেছে, কোথায় স্টক ডেফিসিট আছে, তাহলে আমরা সেখানে পাঠাতে পারবো। These are the 6 monitoring targets. Okay, try to read it from PPT. You remember or not, it doesn't matter. And what are the new things? That is code. These things are bogus. Okay, you have to study one thing, and if it is a question that what are the strength and weakness of Anemia Mukt Bharat, you have to write these points. There are nothing to understand. And this is the PPT overview of Anemia Mukt Bharat. Okay.